I want to tell you about someone. Her name is Jasmine. She is 24 years old. She is in a relationship. She uses a birth control implant, which is a small rod placed under the skin of her upper arm that prevents pregnancy. It works really well. She has not used condoms in 2 years because she does not need them to avoid getting pregnant. Her partner never brought it up. She never brought it up either. She feels completely fine, no pain, no unusual discharge, no symptoms of any kind. One day she goes to the emergency room for a sprained ankle. While she is there, the care team offers her a routine STI screen, which is a test for sexually transmitted infections. She says, sure. They treat her ankle and she goes home. 3 days later, the clinic calls her back. Her test came back positive for gonorrhea. Jasmine is stunned. She had no idea. She felt nothing. She did not know that gonorrhea can live in your body without giving you a single sign that anything is wrong. She did not know that her implant, excellent at preventing pregnancy, does absolutely nothing to protect her from infections. And she did not know that if the phone call never came, the infection could have been quietly causing damage to her body the entire time.
Jasmine is not careless. Jasmine was never told, and the system that should have told her didn't.
Today, we're talking about gonorrhea, what it is, who is at risk, what symptoms to watch for, and how it is diagnosed and treated, how to prevent it, and what the research is telling us about a growing threat that every sexually active person needs to understand. If you're new here, welcome to Melanin Initiative. My name is Dr. Kimberly Madison. I'm a doctoral prepared nurse practitioner and one of your co-hosts here, along with Alicia and Geraldine. Here, we simplify medical information into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. Our mission is twofold. First is to promote that health literacy, breaking down complex medical information. The second is to elevate the expertise of nurses, to bring awareness to all the diverse career opportunities that exist in the industry, and then to let all of our peers know all the different ways that they can leverage their expertise, both as taking care of patients, but also as entrepreneurs. If you haven't already, this is your chance to subscribe. Leave us a thumbs up or two, share this information with at least one person. Go over to the Apple and Spotify podcast and leave us a 5-star review. Every time we engage with our platform like that, it shows the algorithm that this information is important so that when people like you and Jasmine look for topics like this, we'll show up higher in their search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you think you might be having a medical emergency, you seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. If you are listening on the podcast, we invite you to check us out on YouTube or LinkedIn, because throughout the show, we'll be putting up some information that you can screenshot. This way you know exactly how to act on this information and take it with you to your next appointment.
Thanks, Kimberly. So now let's get started. As always, we like to define, what is gonorrhea? Gonorrhea is a bacterial infection. It is caused by a germ called Neisseria gonorrhea. You get it through sexual contact, vaginal, anal, or oral. And it does not just infect the genitals, it can infect the throat, it can infect the rectum, it can also infect the eyes. Each of these sites needs its own test to find it. One test in one location will not catch all of it. Here's the most important thing to understand about gonorrhea before we go any further. Most people who have it feel nothing. No symptoms, no pain, no discharge, nothing. This is especially true for women, and it is especially true for infections in the throat or rectum. You can have gonorrhea right now and feel completely normal, just like Jasmine did. How common is this infection? In 2016, there were an estimated 87 million new gonorrhea cases globally in a single year. That is just new cases in 1 year. In the United States, when researchers tested a large national sample of people aged 14 to 39, about 3 in every 1,000 tested positive. But in communities with less access to healthcare, like a national program screening young people aged 16 to 24 entering job training, that number jumped to 22 in every 1,000 women. In Philadelphia high school screening programs, nearly 1 in every 10 girls tested positive. Gonorrhea rates in the United States hit their lowest point in 2009. Since then, they have been climbing. The World Health Organization has set a goal to cut gonorrhea cases by 90% by 2030. We are not on track.
And this episode is a follow-up to one of our most watched episodes on sexually transmitted infections. That just goes to show us that this is a question that people have, and it's a conversation we're not having enough. And the data shows that 1 in 10 girls in high school in any American city is positive. That is not a distant statistic. That is somebody's neighborhood.
Exactly, Kimberly. So who carries the greatest burden? It's young people between 15 and 24. Yes, 15 and 24. People in communities with limited healthcare access, men who have sex with men, pregnant women, because gonorrhea during pregnancy can cause serious harm to the baby, and communities of color, who the research acknowledges are more likely to be undiagnosed and underserved. The specific numbers on racial disparities are not fully captured in the studies we reviewed, and that gap in the data is itself a problem we are naming directly.
More than half of gonorrhea infections in countries with strong healthcare systems are never identified or reported. Not because people are hiding it, but because nobody tested for it, because nobody offered.
When we say there's gaps, that means that's something you can solve. So whether you're a student getting your bachelor's, your master's, or your doctorate, or you're already in practice and you work somewhere, this is something you can solve right now. So who's at risk for gonorrhea? Anyone who is sexually active can get gonorrhea, but some factors increase your risk more than others. Number 1, having multiple sexual partners, having a new sexual partner, not using condoms consistently. I'm just going to say not using condoms. Being
Right.
under 25, young adults carry a disproportionate share of STI diagnoses. Having a previous STI, because the behaviors and biological conditions that allowed one infection can allow another. And using long-acting birth control without condoms, this last one is critical and connects directly to Jasmine's stories. And we've covered contraception. So you can find that STI, the sexually transmitted infection episode, in our infections playlist. And then the contraceptive one should be there too. Research found that people using long-acting contraceptives like implants and IUDs are about 60% less likely to use condoms compared to people using the pill. That makes sense on the surface if you are protected from pregnancy. Condoms feel unnecessary, but pregnancy prevention and infection prevention are 2 completely separate things. And I think a lot of parents overlook this because a lot of people take their daughter right away to get birth control, and they think that's enough. Mm-hmm. And this shows it that it's not. Now, an implant stops ovulation. It doesn't stop bacteria. Condoms are the only method that does that, and abstinence. Now, that distinction must be made clearly at every contraceptive counseling visit, in person or in telehealth or in your social media content. You want to know something to talk about? This is a great topic. And often we're not doing it enough.
Right. I think it's important to note too that, like, yes, abstinence is obviously the probably the number one way, because if you don't engage in the activity, you're not going to get an infection. But it's also important for our providers out there that to have open and honest conversations with your patients, because you don't want them to feel shamed or uncomfortable coming to tell you the truth, and then you're not being able to offer them what they need to remain safe. And for Jasmine, nobody made that distinction. So not when she got her implant, not at any visit since. That is 2 years of unprotected exposure that could have been different with one honest conversation. And now let's talk about the symptoms, because this is where most people get confused. In women, gonorrhea is frequently asymptomatic. There's occasions where you could have some, meaning no symptoms at all. When symptoms do appear, they can include increased vaginal discharge, burning with urination, or bleeding between periods. And these symptoms are easy to miss or attribute to something else. Literally, I'm thinking like, oh, that could also be a UTI, right? So things that are not sexually related. In men, symptoms are more common. They include a burning sensation when urinating, white, yellow, or green discharge from the penis, and in some cases, swollen or painful testicles. In rectal infections, in any gender, symptoms can include discharge, itching, soreness, bleeding, or painful bowel movements. But again, most rectal infections have no symptoms at all. And in throat infections, also in any gender, there are rarely any symptoms. Most people with gonorrhea in their throat have no idea it is there.
Right. That is 4 different places that the infection can live, 3 of which almost never produce symptoms. This is why testing is the only reliable way to know.
And Alicia, I think you did a wonderful job pointing out how important because it starts with us.
Mhm.
If we're not comfortable, if we don't create that environment for our patients, they're not going to have that experience. And that's why we have these episodes with you guys as patients, so you can help curate the conversation we're going to have today, right? Like I said, we're here to address the problem, but you need to help us address you as the person. And that's you preparing for your visit, using Gigabit Grandma and Grandpa to get your questions out so that once I start talking right away and bring up things you might not want to hear, you won't forget why you came today. And if we run out of time, that's a perfect time to just schedule another appointment, either with that provider or some nurse or NP entrepreneur who can spend a lot longer with you and answer all your questions for you until you get the solution that you're looking for. And I do want to point out, because we talk about abstinence, and that happens in the Black church a lot, in religious communities a lot. And even people, adults who are practicing, not abstinence, celibacy.
Yeah.
And we don't talk about this in nursing school, but there's a belief that oral sex is not the same as actual sex. And so I don't need a condom. I don't need birth control pills. So I'm safe. And that is not, I hope today we're showing that that's not true. That doesn't put you at a risk. And I know for our young people watching who your parents haven't had these conversations with you because they're not comfortable having it either, and their parents didn't have it with them, that might be an epiphany for you. You might be hearing that for the first time, especially if most of your sex information is coming from TikTok. I don't have anything against TikTok. We're on TikTok. I'm just saying, you always want to go to credible resources. We provide a lot of those for you, and we bring a lot of guests on who can do that, and we point you to other directions where you can go read it for yourself. Now, how is gonorrhea diagnosed? You have problems, you schedule an appointment, you come see us. First thing we're going to do is ask you all those questions. And then we're going to say, okay, what do I do with that information? This is the job of me, right? So now I have your information. Our gold standard is a test called nucleic acid amplification test, or NAAT. It can be done using a urine sample, a swab of the genitals, or swabs of the throat and rectum for extragenital infections. You weren't afraid to have sex then, you can't be afraid to get swabbed now. Okay, it is highly curable. It is the test your care team should be using and that you can ask specifically about. There are also rapid diagnostic tests, point of care tests that return results during the same visit. A lot of times when your community has those free screenings, that's what they're doing. So they can test you and give you answers and a solution right there. Don't be afraid of that. Now, these are especially important in emergency settings where patients may leave before standard lab results return. Rapid tests mean a provider can confirm the infection and treat it before you walk out the door. We all live busy lives. This is a wonderful opportunity for you, especially if you can't get an appointment with your primary care provider or your women's health NP. Now, for our LGBTQIA plus community, specifically men who have sex with men, rectal and throat infections are common and almost always asymptomatic. If your care team is only testing one site, they're missing infections. And because we don't really go into detail in our education, it's important that you take this with you to your appointment and ask for it. You're entitled to ask for throat and rectal testing at every STI screening. You got to ask by name, and especially because a lot of people out here practicing right now went through school during the pandemic. And unfortunately, our clinical training was a little bit impaired. So they might be showing up not as prepared as they could have been. So it's okay to ask questions. And if the person doesn't respect you taking the time to ask the questions, that's a good sign they're not the right person for you.
Right. And also as a healthcare provider, because I know we have healthcare providers that are listening, it's important that we also ask the patient specific questions and not feel uncomfortable about asking those questions, because we can't just assume that it's only vaginal intercourse that is occurring. We have to ask male and female, are you having oral sex? Because usually during visits, my STI visits that I have, I ask how many partners, what, are you having oral sex, vaginal sex, anal sex? I ask all of it. And sometimes the patients feel uncomfortable, but I just make them aware, like, I'm asking this because we just want to make sure we're covering all our bases and making sure that we are treating any areas that need to be treated, or testing specific areas and not just one. So the key takeaway here for this section is that most gonorrhea has no symptoms. Feeling fine is not the same as testing negative. The only way to know is to actually get tested at every relevant site. If your care team is not offering extragenital testing and it applies to you, ask for it.
And the question could be like, well, I don't know how to do that. What I love to do a lot of times, especially if I don't want the person to feel offended, I'll say what my other patients really love to ask, or one of the most commonly questions that I get, or I do this with everybody, and that's a great way to kind of break the ice, and you can kind of get rid of some of that if you're concerned about how they're going to receive it. Or the data show, it has to be natural to you, right? I read data, so I talk about data. I'll say, the data shows us that if we don't ask, people won't know, right? And the truth is, every time, and I hear this, right? If we take the time with patients, they feel more comfortable. And sometimes I don't believe it because I have all these conversations where they don't believe me. but when I do it and I see a difference in the patient, it reminds me like, okay, that's true. They really do want to hear it from us, Now, gonorrhea is curable. That's the great news. If it's caught and treated correctly, it can be fully cleared from your body. The current standard treatment in the United States is an antibiotic injection called ceftriaxone. It's given as look. I know you don't like needles. Then just wear a condom.
Right.
This is so easy. Okay. It's given as a shot, usually in a clinical setting, and play some music or some comedy. We talked about distraction, non-pharmacological pain options. In some cases, it is combined with a second antibiotic taken by mouth. Now, treatment must be completed fully, and your partner must also be treated. Otherwise, reinfection happens immediately. If you can't communicate with your partner, you shouldn't be having sex with them. Now, this is where expedited partner therapy comes in, EPT. This means that your care team can provide a prescription or medication for your partner to treat them without requiring them to come in separately. That's wonderful because we know our men, if you happen to date men, they hate going to the doctor. And if you date someone who is in healthcare, like they work there, they also hate going to the doctor. So go take that to them. Now, it's legal in all United States, every single state, and it is one of the most effective ways to break the cycle of reinfection. If your care team does not offer it, you have a job too. You can ask, can my partner receive treatment without coming in? A test of cure, a follow-up test to confirm the infection has cleared, is recommended for certain infections, particularly throat infections, which are harder to treat. Ask your care team whether you need one. Now, I need to talk about something really serious here because gonorrhea is becoming resistant to antibiotics. Resistant means that the medicine that used to kill the infection is starting to stop working. That means when you're in trouble, you need help, we have less options. Now, think of it this way. If you spray bug spray on ants every single day, eventually some of those ants, they survive it. This is the strongest of the fit. The ones that survive pass their survival ability onto their offspring, so all their little babies. Over time, you end up with ants that the spray can't touch anymore. That is what is antibiotic resistance. The bacteria learn to survive the medicine. Now, gonorrhea, Neisseria gonorrhea, the bacteria that causes gonorrhea, has already developed resistance to every antibiotic class that has ever been used against it. Penicillin, tetracycline, fluoroquinolones, all gone. The injection used today, that ceftriaxone that I talked about, it is still working, but there are already documented cases that are resistant to that one too. Now, the World Health Organization has warned the world because we're in a global market, right? It's real easy. Someone can be in Japan on Monday and in New York by Tuesday night for dinner. And they do that every single week. Now, a common infection, it may be on the horizon, an untreatable gonorrhea strain. Not a rare edge case, a common infection potentially becoming incurable. That is the direction we're heading if resistance continues.
And to give you some numbers, an infection that 87 million people acquired in 1 year, becoming something medicine cannot fix. The World Health Organization said that. That is alarmist. That is a warning we need to take seriously right now.
And so here's what this means practically. Take every dose of your treatment, all of it, even when you feel better, especially when you feel better. Do not use leftover antibiotics to self-treat. Don't borrow from your family. Do not take antibiotics because you think you might have been exposed. You always want to get tested, treat based on those confirmed results, not guesses. Now, for our nurse and NP entrepreneurs, gonorrhea is mandatorily it's a mandatorily notifiable infection. Every confirmed case must be reported to your local public health agency. That reporting step must be built into your clinical systems before you see your first positive result. Know your state's reporting deadlines, know your state's EPT laws, and build your callback protocol. A standard process for every patient whose positive result returns after they have left your practice. That callback is one of the highest yield public health interventions in primary care. One phone call closes the treatment gap.
So I know that was a lot. So let's recap, okay? Gonorrhea is curable, but only if it is caught and treated correctly and completely. Take your full treatment. We can't emphasize that enough. Make sure your partner is treated too. And know that the medicines we rely on are becoming less effective. So getting tested and treating confirmed infections precisely is how we protect those medicines for the future.
Let's talk about prevention, because most of this is preventable. The most effective way to prevent gonorrhea is consistent condom use, every time, with every partner. Condoms create a physical barrier that stops bacteria from passing between people. No other contraceptive method does this. Not the pill, not the patch, not the implant, not the IUD. Condoms are the only method that prevents both pregnancy and STIs at the same time. Get tested regularly. If you are sexually active, especially with new or multiple partners, routine STI screening is part of taking care of yourself. The CDC recommends annual gonorrhea and chlamydia screening for all sexually active women under 25 and for older women with risk factors. For men who have sex with men, screening is recommended at least annually and every 3 to 6 months for those with higher risk, including throat and rectal testing at every screen. Know your partner status. This is a conversation that feels uncomfortable and happens less often than it should. Knowing whether your partner has been recently tested and what their results were is a reasonable and important part of sexual health. Talk to your care team about PrEP. PrEP stands for pre-exposure prophylaxis. It is a daily pill now, or now an injectable given every 2 months that prevents HIV infection in people who are at risk. Gonorrhea and HIV share risk factors, and the presence of gonorrhea makes HIV easier to acquire and transmit. If you have had gonorrhea, if you have multiple partners, or if your partner is HIV positive, PrEP is a conversation worth having. You can ask your care team directly, am I a candidate for PrEP? And that's something that I also bring up to my patients that come in for STI testing. I'm always some of them are not aware of PrEP, but I always bring that up. I had a patient that was like, well, I don't want to come back and because with PrEP, you do have to get blood work every 3 months, just to make sure your kidneys are not responding negatively to the meds. And I had one particular patient said that he didn't like needles, but I was like, well, but you still have to come in and get an injection if you contract gonorrhea, or so what do you want to do? So just kind of having that conversation with patients is important.
Couldn't agree more. So for long-term maintenance, meaning what you do after treatment to stay healthy, here's the short version of that. So you retest after treatment to confirm the infection is gone. Please do not resume sexual activity until you and your partner have both completed treatment. Get screened again at your next regular interval. And if you have had gonorrhea once, understand that having it once does not make you immune. You can get it again. Consistent testing and consistent condom use are the long-term strategy. I also want to add that it's just good practice that before you even engage in sexual contact with a partner, that you both get tested before you start the first time. So just know your status up front so that you can prevention's key here, any passing of STIs to begin with. And of course, we love our partners, we trust our partners, but people are human, so you never really know. So even if you are in a long-term relationship, you should still get tested regularly just to ensure that everything is remaining STI-free. So for our older adults, STI prevention does not have an age limit. If you are sexually active, these recommendations apply to you. Ask your care team for routine screening. It is a standard test, and you do not need a special reason to request it. For our veterans, STI screening and PrEP are available through VA healthcare. Ask for both at your primary care visit. And for people who English is not your first language, you have a right to receive test results, treatment instructions, and prevention counseling in a language you understand. Request an interpreter. Request written materials in your language. That request is protected.
And like I've shared in other episodes, with AI, you can really make anything, you can translate it into your language. This is not the first time we've talked about PrEP. We've talked about it with the great Kenya Hutton, the president and CEO of the Center for Black Equity. He's come on twice to talk to us about Black Pride. And in his first episode, he'll into great detail about that. Now, for everyone, the stigma around STI testing is real, and it keeps getting people from getting care. Getting tested is not a reflection of your character. It is a reflection of your commitment to your health and the health of people you are intimate with. Jasmine got tested because she happened to be in the emergency room. You do not have to wait for a sprained ankle. You can walk in and ask. Now, our takeaway from this section, one is don't forget older adults. They're still very sexually active. They're still getting married. They're still going on dates. The problem is sometimes if we have an adult child who's helping make medical decisions, they're uncomfortable. And so just like we do for our adolescents, we want to create an opportunity for them to talk to us privately so that they can be comfortable, have the conversation, and get the care they need. For everyone else, condoms prevent gonorrhea. Routine testing catches it early. When people say, what's the difference between nurses and doctors? We're all about health promotion. That's what we're doing right now. And disease prevention. That's what we're always talking about. The ways you can prevent things, why you need to go to primary care. We already know what the other side of it looks like when you don't do that. We're trying to prevent all the things you complain about. If you do some of these things we're saying, you won't end up in those positions as much. You'll help reduce your risk. So routine testing catches it early. You can be afraid of needles, but you can be more afraid of the disease, more afraid of missing work, more afraid of the infection, more afraid of having to have these conversations with someone you just started dating and having sex with. Now, partner treatment prevents reinfection. PrEP prevents HIV. These are not complicated steps. They're very specific, evidence-based actions that are available to you right now. The only thing standing between you and using them is knowing they exist.
And now you know. So before we bring Jasmine back, here are your action items, because we have to leave you with something. If you are a patient or caregiver, ask your care team at your next visit when you were last screened for gonorrhea, and whether that screen included your throat and rectum, if relevant. Ask whether your birth control method protects you from STIs. Ask about PrEP if you have risk factors. And if you are tested today, ask what the plan is if your results return after your leave. If you are a nurse or a nurse practitioner, every contraceptive counseling visit needs an explicit STI prevention conversation. Build or advocate for a callback protocol for positive STI results in your setting, and offer extragenital testing proactively for patients who need it. And lastly, if you are a healthcare entrepreneur and cosmetic MP, build your mandatory reporting workflow, your callback protocol, and your EPT process before you see your first positive result. Consider whether rapid point-of-care STI testing is feasible in your clinical setting. It closes the treatment gap and protects your patients.
When it comes to ideas for business opportunities, I love this one. The sexually transmitted infection, you will always have a customer. Mm-hmm. That episode shows us how popular it is. We know it's very popular. I can't remember if they're in the pharmacy field. There's these guys, some Black guys, they have their whole business set around STI testing. And they do, I think they're in Florida. They have mobile clinics and they go to the communities of the people who don't like to come see us. They decided, I'm going to fill that gap. That's a problem. I'm going to address it. He goes there, they go there, and they take care of them. And I want to say they have like an app or something. But anyway, that's something, it's not sexy, but it is profitable. Mm-hmm. And you will help people at the same time. And you don't have to know this is a specialty. All you're going to do every day is sexually transmitted infection testing. That's it. Okay. So let's go back to Jasmine. The emergency room called her back 3 days after her visit. A nurse walked her through what the results meant. She explained that gonorrhea often has no symptoms, especially in women. She explained that Jasmine's implant protected her from pregnancy, but not from infections. She arranged for her to come in for her treatment and get that ceftriaxone injection. Now, during the visit, the care team, because there's more than a nurse and a doctor, they're taking care of you, gave Jasmine a prescription her partner could use to get treated without coming in separately. She saved her both time and money, and her partner. They explained clearly that condoms are the only method that prevents both pregnancy and STIs. They talked to her about HIV risk and scheduled a follow-up to discuss PrEP. Then they scheduled a test of cure to confirm that the infection was actually cleared. On her way out, Jasmine said something that the nurse wrote down. Nobody ever told me this. They just gave me the implant.
Wow. And you know what, Kimberly? That sentence is why this podcast exists. Nobody ever told me any of this. That is the gap. That is what health literacy is here to close. And I must add, Jasmine and her partner need to have a conversation because I went in for a sprained ankle and I ended up with gonorrhea. Something is afoot here. So wanted to add that in there.
Yeah, so Jasmine went to the emergency room for a sprained ankle. She left with information that may have prevented permanent damage to her reproductive health and reduced her HIV risk. One callback, one honest conversation, one care team that did the whole job. That should be the standard everywhere for everyone. A heart attack does not always look like the movies. It does not always come with someone clutching their chest and falling to the floor, especially not in women, and especially not in Black and brown women. Here are the signs: chest discomfort, pressure, squeezing, fullness, or pain that lasts more than a few minutes or goes away and comes back. Discomfort in the upper body, one or both arms, the back, the neck, the jaw, or the stomach. Shortness of breath with or without chest discomfort. And other signs that women more commonly experience include nausea, lightheadedness, and unusual fatigue that comes on suddenly and feels different from normal tiredness. Women are more likely than men to have a heart attack without classic chest pain, and research shows that women's symptoms are more likely to be dismissed by care teams and by themselves. Do not dismiss yours. If you think something is wrong with your heart, call 911. Do not drive yourself to the hospital. Do not wait for symptoms to pass. Aspirin may help if you are not allergic, but call 911 first. Know the signs, trust your body, act fast. This message is brought to you by the Melanin Initiative Podcast, where we simplify health information so you can advocate for yourself and the people you love. Find us on Apple and Spotify.
And the reason no one ever told them is, one, we don't talk about this enough in our own training. And two, once we are in clinical practice training, sometimes we just don't have the time. It doesn't mean that we don't have the heart, we don't care. We just don't always have the time that's available to us. Time and knowledge are the biggest problems. So today we cover the definition of gonorrhea, its incidence and prevalence. So that's how often new cases are occurring, and at any one point in time, how many people are actually impacted. Who is most at risk? Why most infections have no symptoms, which is like most of the things we talk about. How it's diagnosed. So this is what you're going to expect when you get your visit. How it is treated. That antibiotic resistance, because even antibiotics are not always great all the time, and what it means for all of us. Prevention, including condoms, routine testing, partner treatment, partner communication, and PrEP, and what that long-term maintenance looks like after the diagnosis. All sources are linked below, and we've done some screenshots for you throughout this episode. If you're listening on Apple and Spotify, be sure to come on over so you can get those screenshots and share it with at least one person and take it with you to your next appointment.
So, all right, everybody. If this episode gave you something, share it. Someone in your circle is Jasmine. They feel fine. They have never been told that feeling fine is not the same as testing negative. Send them this episode. Find us on Apple Podcasts and Spotify. Leave us a review and tell us what topics you want us to cover next. This podcast exists because of this community. And if you are a nurse practitioner who wants to go deeper on the business and clinical side of healthcare entrepreneurship, visit Mahogany Dermatology Nursing and the Alliance of Cosmetic Nurse Practitioners. Links are in the show notes. If you found this information helpful, check out our episodes on medical billing and insurance. We are the Melanin Initiative. Until next time, take care of yourselves and take care of each other.